In the heart of London is a leader who believes the truth must be told in a powerful way about the health and well-being of the world's 7 billion people. Richard Horton, the editor-in-chief of the international medical journal, The Lancet.
At The Lancet, what we've tried to do is to use the science we publish in two ways. First, as a means for advocacy, to try and draw attention to some of the most pressing health issues in the world and put them into the agendas of presidents and prime ministers. But also we want to hold those with political power accountable for their promises and commitments. We have leaders around the world who say one thing and do another. Science is an incredibly powerful tool to hold those political leaders to their promises and commitments.
There is virtually no major policy debate or new health policy adopted over the past quarter century that has not first been championed in the pages of The Lancet.
He just deserves an enormous amount of credit. It's rare that a single individual can so influence an entire discipline. And Richard, if you're ever with him, can be a force of nature.
Dr. Horton was an early champion of the health effects of climate change. A commission he convened more than a decade ago concluded, when climate change is framed as a health issue rather than purely as an environmental, economic, or technological challenge, it becomes clear that we are facing a predicament that strikes at the heart of humanity.
So we were kind of 12, 13 years ahead of the time, and all of the things that we predicted have not only come true, but they've come true rather quicker than we expected. So Richard had the foresight to see this. And ever since then, he has tried to tie his commissions to policy action.
For several decades now, Richard has truly been the megaphone for global health, for the use of data science, of big data, of smaller data and evidence as the underpinning of policy, and that combined with an overriding concern also for human rights and for overcoming inequities.
Those inequities are at the heart of Dr. Horton's passion, evidenced by The Lancet's annual publication of the data-driven study, The Global Burden of Disease.
And I first learned of the global burden of disease from the World Development Report that was published in 1993. And I was immensely excited by what we now talk about as the GBD, because the GBD is nothing less than a human genome project for human health. So to me, it informs everything that we do here at The Lancet.
Richard has never been afraid to speak out and to stand up for what he believes in. I share most of those beliefs. It's an immense legacy. Don't stop now.
He's incredibly bright, witty, and captivating. But he provokes, he irritates, and most importantly, I think he makes individuals think and reflect about their own life and the world in which we live in. That's a remarkable achievement for a single individual.
He combines science with passion for justice. Richard is the kind of person who will not give up on issues if he understands that there's a cause somewhere.
Richard's work on maternal health has highlighted the fact that it's really very complex. It's not as simple, there's no magic bullet in all of this, but Richard's done much more than that. He's mobilized political attention on this issue at a global level, bringing together some people that you wouldn't normally expect to be sitting in the same room and to be addressing some of these issues. And his ability to convene people, to bring people with quite different perspectives together has been remarkable.
For his excellent work, he has won the most prestigious award by the Chinese government to a foreign national, the Chinese government's Friendship Award.
He has been outspoken in his support of women's health and rights, and his focus on maternal and infant mortality has been very important. I will always admire Richard's insight, his intellect, and his passion for global health.
Dr. Horton personifies the Lancet's manifesto. Improving lives is the only end goal, and that research is only relevant when it has an impact on human lives.
The idea behind what we do is really going back to the age of the Enlightenment, the idea that the purpose of creating knowledge isn't just to publish it or to put it on a website or be in a journal, but actually that knowledge needs to do some work. Knowledge published in order to accelerate social progress.